Hello. My name is Jones, and today we are looking at a topic in mental health known as crisis or mental health crisis. So, mental health crisis has been defined as an internal disturbance caused by a stressful event or perceived threat by self in which an individual's usual coping skills don't work, precipitating an increase in anxiety in that individual. So this event occurs when an individual is threatened by a certain life circumstance or stressor. Okay, so the individual cannot effectively manage by using his or her usual coping skills. So other authors have looked at a crisis as a result of an impediment to life goals that people believe they cannot overcome through customary choices and behaviors. Or a crisis has also been viewed as where an individual knows no response to deal with the situation that they are facing. So in defining crisis in mental health, we just look at it as any situation in which a person's behavior puts them at risk of hurting themselves or others, or prevents them from being able to care for themselves or function effectively in the community. Okay, so many things can lead to a mental health crisis. Some examples of situations that can contribute to mental health crisis may include home or environmental stressors, school or work stressors, and others are literally general. So when you say home or environmental stressors, this may include changes in relationship with others, losses of any kind that is due to death or estrangement, conflicts or argument with loved ones, trauma or exposure to violence. Then school or work stressors, worrying about upcoming projects or tasks, feeling singled out by co-workers, peers, or feeling lonely. Or it can be lack of understanding from peers, co-workers, teachers, or supervisors. Sometimes it's also due to real or perceived discrimination or failing grades or losing a job. Some general causes of the crisis include being in a crowd or large group of people, or experiencing community violence, trauma, natural disaster, or terrorism. Or it can be because of pending court dates, or using or abusing drugs or alcohol. Or other things may include starting new medication or new dosage of current medication, like for a chronic illness, so that can be a form of stress or a cause to stress. Treatment stopping also can be a form of stress, as an individual can start worrying about resistance. Stopping medication or missing some medication can be also some kind of crisis in a patient because of fear of resistance. So now, with that discussed, let's now look at crisis formation. So how does a crisis come about? How does a crisis form? So number one, a negative event will occur which will lead to a feeling of subjective distress. Then number two, the distress will lead to an impairment in functioning. Then number three, coping skills will fail to improve the functioning, so the individual ends up in a crisis. Warning signs of mental health crisis. So it's important to know that warning signs are not always present when a mental health crisis develops. So common actions that may be a clue to a mental health crisis developing includes inability to perform daily tasks like bathing, brushing teeth or brushing hair, rapid mood swings, increased agitation, verbal threats, violence, out of control behavior, abusive behavior to self and others, isolation from school, work, family or friends, losses loss of touch with reality, okay, or psychosis. So that is unable to recognize family or friends. Okay, so now we also see isolation from schoolwork, abusive behavior to self and others, increased agitation and the likes. Paranoia can also be seen. Okay, so when the crisis involves the risk of suicide, there are certain things that can be noted. So risk of suicide is a major concern for people with the mental health condition and those who love them. So encouraging someone to get help is the first step towards safety. People who attempt suicide typically feel overwhelmed emotionally, and they feel frustrated, they feel lonely, hopeless, and powerless. There's some feeling of worthlessness and the like. So the social isolation, so common in lives of those with mental illness, can reinforce the belief that no one cares if they live or die. So any talk of suicide should always be taken seriously, and all common warning signs of suicide should also be noted, such as giving away personal possession, okay, taking steps to tie up loose ends, or talking as if they are saying goodbye, or increased drug alcohol use, failed romantic relationship, or sense of utter hopelessness or helplessness, or history of just suicide attempt or self-harming. So such should be taken note of. So the cognitive key here refers actually to the belief about the negative event that this person might have had, and which influences how well or will be able to cope with the event. If at all, for them, it's how to say, I'll commit suicide, then they may commit suicide. So you have to change the perspective so that you improve their ability to cope. So the basic formula for crisis intervention, meaning it just involves altering the perception, lowering the distress, and also improving the functioning so that it returns to normal. Hence the patient will not commit suicide. So now let's look at the domains of a crisis. So we have the following domains in crisis: developmental crisis, situational crisis, and existential crisis. So a developmental crisis is the result of normal life event like a pregnancy or graduation that causes stress and strain on an individual. Okay, so while developmental crises are normal, they may need close monitoring to ensure that a client returns to normal functioning. So one useful way of conceptualizing a developmental crisis is to consider the concept of grief and loss, because all changes in a person's life result in loss, and loss requires grief work to process, and individuals will need to take time to process their life changes. So then there is this domain known as situational crisis. A situational crisis is the most common kind of event when we consider crisis intervention. So this is an event that is so overwhelming and sudden. So that is, it overwhelms normal coping mechanism. For example, a situational crisis includes sexual assault, a motor vehicle accident, or sudden loss or grief. So this is the most common form of crisis that emergency responders and other crisis intervention workers are likely to encounter. Okay, and now when you look at this now, this is more of an emergency. Then there is existential crisis. Existential crises are based on a larger concept of a person's purpose and the attainment of actualization. A deep sense of personal fulfillment also related to situations of regret or or belief that life has passed them by. This is by their realization that one will not reach goals they had set for themselves at a certain age. So they feel life has no purpose. Okay, so they feel they will not realize, so they now enter some existential crisis. So existential crises are particularly common at life transition points like 30 to 30, 40, and 50, when people take stock of their life. A significant existential crisis can predispose to suicide and may be linked to the markedly high suicide rate among men and women between 45 and 54. So other theories of crisis and crisis intervention are that there are varieties of other resources identified by James 208 that are not covered here. So some of them include psychoanalytic theory, systems theory, ecosystem theory, adaptational theory, interpersonal theory, chaos theory, and developmental theory. Then other models of crisis intervention may include the equilibrium model, cognitive model, psychosocial transition model, and developmental ecological model. Then the last one being contextual ecological model. So these are some of the models that you have to consider in a crisis intervention. Okay, so now let's look at the stages of crisis. So the first stage of crisis, occurs when the person is confronted by a stressor. Okay, so exposure to this stressor would result to anxiety. The individual then tries to handle things by using his or her customary coping skills, and then they do not work. So this is the first stage. Then the second stage of crisis occurs when the person realizes that his usual coping ability is ineffective in dealing with the anxiety. As the person becomes aware of his unsuccessful effort in dealing with the perceived stressor, he moves on to the next method of solving the crisis. Then the third stage of the crisis is where the individual tries to deal with the crisis using a new method of coping. So this is what happens in stage 3. Then the fourth stage of a crisis takes place when the person's coping attempts of resolving the crisis fail. So all new ones, old ways, the new methods, they fail. So the individual then experiences disequilibrium and significant distress. Hence, this result in stress. Okay. So there are a lot of types of stress, maybe that we might not have mentioned here, but we believe some can still be covered in other topics that we are going to cover. So crisis intervention may refer to method used to offer immediate or short-term help to individuals who experience an event that produces emotional, mental, psychological, and behavioral distress or problems. So a guide to an effective crisis intervention may include assisting the person to view the event or issue in a different perspective, assisting the individual in learning new methods of coping. Okay, so the main purpose actually of a crisis intervention is to prevent illness, and that is both physical or emotional, and also to give an individual new methods, new skills of dealing with problems without developing an illness or some kind of disequilibrium. So that is on crisis intervention. So thank you very much.